uterine fibroid is just an abnormal growth that is within the uterus in women. A lot of women complain about, oh, I just went to see my doctor and I just found out I have fibroids. Some women even think they're pregnant and they go in to check if their baby is alive, and then the doctor tells them, oh no, you're not pregnant, you just have a fibroid. So what is uterine fibroid? What's fibroid? It's just an abnormal growth within the uterus. What is the uterus? That's the womb that carries the babies for women. It's non-cancerous. That means it's benign. It's not harmful in the sense of cancer. It's just an abnormal growth within the womb. Now, why does it happen? Like, how can I just be sitting and this just grows in me? As long as you're a woman and you're black, you're African, Afro-Caribbean, you're a black woman, you have a higher risk of having this growth. It doesn't mean it cannot happen in all women. Of course it does. But these are women who have, black Africans have a higher risk of having this fibroids within them. And also the fact that if you do not have, when I say low parity, the fewer children you bear, the higher your risk of fibroids. So that takes you to what is causing this. It just means that the female hormones in your body, they just need to do something. You can imagine, as long as you're female, those hormones, estrogen, I don't know why, they just want something to grow in you. And then, boom, you have your fibroids growing. A lot of women complain about, so I have fibroids, should I take it out? Shouldn't I take it out? First, let's go to the symptoms. If you have uterine fibroids with no symptoms, based on the fact that the size is small and your doctor tells you, don't worry, it's okay, it's small, it's not in a place that will affect your childbearing and all. Sometimes you just monitor and follow up with the doctor 6 monthly, 1 year, and it all depends on what routine you're given. But in some women, there are symptoms. Either heavy uterine bleeding during your menses. You notice that your menstrual flow is lasting longer and it's heavier. This should just mean that either the fibroids are within the lining of the womb or within the muscle of the womb, and their size is large enough to increase the surface area of, they stretch out the womb, and so you get more bleeding during menses. Also, pain. It could increase menstrual pain in some women, while for others it could just be compression based on the size, making you urinate more frequently or even going to toilet to defecate more frequently. So these are the subtle signs of uterine fibroids. And of course, overall, as it applies to a fertility doctor, it could delay fertility. It does not mean that when you have fibroids, you cannot get pregnant. No, please. You can have fibroids and get pregnant, have your babies, and there will be no problem. But it's important to know that fibroid can affect pregnancy and pregnancy can affect fibroid. What are you talking about, Dr. Racheal? I'll break it down. Fibroids can affect pregnancy by delaying pregnancy, and when it does happen, it can increase miscarriages, because it's possible that the baby decides to go round and implant around and close to where the fibroids are, or even on top of it or beside it. And while it grows, blood supply could be cut off from the bed where the baby is trying to grow, and that can cause early miscarriages. Also, it can increase pain during pregnancy. So you will be pregnant and you have a lot of pain. You can even feel the spots, the points where the pain is. And that could just be because there are little seedlings of fibroids in these places. Also, even the appearance of pregnancy Some people have bumps and be wondering, but I'm just 4 months pregnant. Why is there a bump here? Will just be the fact that as the baby is growing, is expanding, and the womb is also expanding, and then it's more visible, particularly when you have what we call a subserosal fibroid, please. Subserosal fibroid. So that's like on the surface of the womb, and so it's more visible. For other women, I mean, a lot of discomfort in terms of sleeping because the fibroids are big, growing, the baby is growing, and so you find that the womb, the overall pregnancy looks larger than it should look for that age of the pregnancy. So now, because fibroids are like benign growth and they like women of childbearing age because these women have estrogen within them. That's like the female hormone that makes us chubby, succulent, everything nice. The beauty of women. Estrogen does a lot to make women look good. Now, if you've taken out your fibroids before, there is a very high chance it can grow again because the reason for the growth has not been removed. If you're not getting pregnant, if you take out the fibroids and you don't get pregnant, there's a high chance that it will grow if you still have your estrogens pumping within you. But for women who are older, menopausal women, at this point, you don't have enough estrogen even for yourself. So you'd realize that the fibroids may even shrink, and over time, you hear nothing about them. They just go away sadly, like, goodbye. There's nothing for us to eat or drink here. But going. So that's really it. So a lot of women keep asking me, Dr. Rachel, should we take out the fibroids because we know it can grow again? If the fibroids are not of a size that you should run after them, if those fibroids are not disturbing you in terms of giving you any symptoms of bleeding, pain, pressure, you have no reason disturbing them. But if the fibroids are large enough, based on the criteria for your country, for your hospital, and they're giving you symptoms, then we could go after the fibroids. But you need to know and remember that as long as that womb is not carrying a baby, there's a very high chance that it can grow again. So I know you're like, Dr. Rachel, you're just saying everything everywhere. What do you want us to take home from this? So, uterine fibroids are benign growth that is within the uterus. They are not cancerous. Yes, there's a 0.1% chance of them being malignant over time, but it is very rare. They could exist within a woman and you may never know. Maybe during a routine scan or even during a cesarean session, you could find out. They may or may not give you symptoms. And when they do, it could just be increased menstrual flow, duration, pain during menses, and also pressure symptoms, increasing urination, increasing frequency of defecating. Fibroids can be managed conservatively with medication or or expectant by going for a routine check, or you may need surgery. But you need to check with your doctor and know what really works for you. Can they grow again? Yes, they can. So you need to be sure of exactly what you want, what your plans are for your future reproduction, and then you and your doctor can decide what is best for you. If you want to know more about your health, please subscribe to our channel, turn on your notification buttons, press like, and we'll bring more to you. And you can also send us comments, and we can also talk about things you want to know. So till then, see you later. Bye.